I would like to recall that previously all the CIS countries were within one system. But then, after gaining independence, each country individual was conducting their reforms in the social and medical insurance. It was supported at the political level in the countries that are participating in this webinar today, in Uzbekistan, Tajikistan, and others. Dr. Bayar Sahan is going to speak now. He is representing this P4H system in the headquarters of the WHO in Geneva. He has MPH from Boston University and PhD from Tokyo Medical University. Previously, he worked with the government of Mongolia, and he worked in the Committee on Planning and Economic Development, and worked at the position of the minister. And since 1999, he worked in the Pacific Representation Office of the WHO. The network was created in 2007 during the G8 summit, and 40 countries from Africa, Asia, Europe, and America are taking part in this network. Mr. Boyar, please. The floor is yours. Thank you. Good morning and good afternoon. Good evening, distinguished participants. I'm welcoming you on behalf of our network. I'm pleased to say that the network has recently expanded its activities and received good support from our partners and CS communities. We created pages for each CS country and regularly update this page with the latest news and information. Soon we will publish a quarterly newsletter and create a CIS virtual space for knowledge exchange between experts on the same P4H digital platform. This webinar is the third one. The first one was organized in June 2020. Where we discussed healthcare financing reforms in selected CS countries. But the pandemic prevented us from continuing our collaboration. But we know that each individual country reacted to the pandemic, and the experience gained in this work are very important for all of us. 4 weeks ago, we organized a webinar with the representatives from Azerbaijan, Kazakhstan, and Kyrgyzstan, with the technical support from the WHO and ILO. The main topic of this webinar was health financing and social protection for the universal health coverage in the context of health insurance developed and practiced in 3 countries. We touched on very many interesting issues, including the role of the state financing, the introduction of payments, and extension of the access to the medical services to all citizens. We also discussed the collaboration between the key ministries, such as the ministries of finance, labor, social security, and health. We also had questions and answers. You can all this find on our web page. Today we will continue this topic and discussions with the participation of international experts and distinguished representatives of Tajikistan and Uzbekistan. Taking this opportunity, I would like to express my sincere appreciation for your participation and wish every success in your reform process and collaboration in your health financing and social health protection systems. Thank you very much for your attention. Thank you very much to you. A very interesting statement. And now we give the floor to Mr. Mikhail Pushkin, who works in the ILO and dealing with the CIS countries. He graduated from the Moscow State University. He held various positions with the government, and in 2000 he worked in Norway. And later on, he was appointed as a senior counselor in the Ministry of Labor of Norway. And since 2014, he works in the ILO, dealing with the youth and CIS countries. And now he's working in the ILO, dealing with the CIS countries and Eastern Europe.
Thank you very much. Dear Mr. Muhsinzoda, First Deputy Minister of Health and Social Protection of Population of Tajikistan, dear Mr. Sharipov, Executive Director of the State Health Insurance Fund of Uzbekistan, dear colleagues in Partnership for Health, WHO, dear participants, ladies and gentlemen. It's my pleasure to welcome you at this important event introducing social health protection and health financing reforms in countries of the Commonwealth of Independent States. You know that social protection lies at the very heart of the ILO mandate as a powerful mechanism ensuring people's well-being, their right to decent life, their dignity. There is no decent work, no conducive business environment, no gender equality, no decent working conditions, no decent retirement without a strong and well-funded system for social protection. The ILO is more than 100 years old. It celebrated its centenary back in 2019. The ILO Social Security Convention 102 was adopted in 1952. The Social Protection Floors Recommendation 202 in 2012. Still, policymakers, scientists, and practitioners argue on universal social protection, which remains a goal and a dream for many in the world. We saw these discussions when the ILO was about to adopt the Centenary Declaration on the Future of Work. The universal social protection is a strong tool to reduce poverty, to secure inclusion and equality, as well as living standards, but it's also a powerful anti-crisis measure. It's not a cost, but rather an investment in people and in economy, an investment which gives multiple returns. Integration of social protection, including health and employment, creates a mighty synergy, a service for the future with the capacity to both protect, heal, and guide a person back to the world of work. Ladies and gentlemen, since the 90s, CIS countries have been making significant efforts to adapt national social protection systems to new challenges. These efforts include reform in social health protection. We should remember that social protection is a human right. Making this right a reality became even more significant during the COVID-19 pandemic. We have seen unprecedented response of health systems globally and in our region. The responses included a range of measures, including additional financing, and have stressed the need to build robust, adequately financed systems that can address health needs of the entire population and respond to external shocks. However, there are still many challenges ahead before we see the human right to health being realized. In the world, only 47% of the population is covered by at least one social protection benefit, and only 2/3 of the population is effectively protected when it comes to social health protection. Coverage with health protection in Europe and Central Asia is above 90%, but this aggregate number conceals significant disparities between the countries. For example, co-payments and out-of-pocket payments have an important role in accessing health services. In our sub-region, out-of-pocket payments oscillate between 26 and 85% of current health expenditure and can have detrimental effects on everyone, but in particular on large share of population who live below, around, or just above the poverty line. They can push them into deep poverty, or they may forge health services because they cannot afford them. From that perspective, design of the system that is equitable, sustainable, and provides good quality services for workers, their family members, and entire population has a long-term effect not only on health status, but also on poverty and overall well-being. The reforms of health systems in Tajikistan and Uzbekistan have shown good results in terms of health protection of disadvantaged groups. Elements of a comprehensive systems have been outlined, and to some extent we can see that they follow ILO social protection floors recommendation. At ILO, we have been engaging substantively in both countries on core social protection issues, and we are now looking forward to delving deeper into social health protection topics, together with our constituents and partners in P4H and WHO. I look very much forward to hearing about recent developments with health system reforms in Tajikistan and Uzbekistan, and to possible further engagement on the path of realization of human right to health for everyone. With this, I wish you all a very productive event, and thank you very much for your attention. Thank you.
Thank you very much, Mr. Pushkin. It was a very interesting presentation. And now I would like to present the next speaker, Mrs. Habic, a well-known international expert. She works in Barcelona branch office of WHO. She worked in Estonia in Ministry of Social and Health of that country, Social Security, where she dealt with the cooperation with many organizations and also covered the reforms in the CIS countries. And she graduated from the Estonian University and cooperated with the World Bank, and she was a consultant. The floor is yours, please.
Thank you so much for this introduction, and thank afternoon to everyone. I tried to share my screen now, so I hope you can all see. Yes, we see it in a presentation mode. Perfect. Are you? Sound is muted. Yes, I was muted. Apologies. And during the next 10 minutes, I'd really like to set the scene for the following presentations and to take more European region perspective. But before I'm starting, I really wanted to congratulate both countries, like Uzbekistan and Tajikistan, because with both countries we are working very closely, very hard in helping. In Tajikistan case, is really to find the best way how to move forward with health financing reform, with mandatory health insurance reform, and then with Uzbekistan, it's in a piloting phase of the health insurance model, and then there is a lot to learn for both countries from other countries globally, but also in our region. But also there is a lot to learn from both countries. So it's for example, it's our colleagues, it's from Kyrgyzstan and Ukraine, it's have been really keen to learn more about the progress made in Uzbekistan regarding the ongoing health financing pilot. But going to the presentation, it's when we talk about health financing reforms, it's very important that we really keep in mind what is the objective of these reforms, and it's definitely not a news for you that we really all countries are committed to move towards universal health coverage, meaning that all people should have access to needed health services, including medicine, without facing financial hardship. And I know that it's in both countries this is something what is written very clearly in high political agendas. It's something what really president of the country is seeing as a way forward and a very strong political commitment. And visualizing, because it's when we talk about universal health coverage, then we are using the symbol of umbrella quite a lot, because it's a parallel with a rainy day. It's very, very clear and evident, because when weather is nice, when sun is outside, we don't need umbrella. It's same when we are healthy. We don't think about how our health system is organized and what is our insurance coverage when we become sick. But when rain starts or we become sick, it becomes very, very important. Sometimes rain is very heavy, wind is very strong. And if our umbrella is weak, then this umbrella does not offer us protection we do need during these rainy days. And same is with health financing systems, health insurance systems. They have to be strong to protect us when we become sick, and everyone. It's really very important here as a message is that every one of us needs that very strong umbrella. It's very important not to leave anyone behind. And when we talk about universal health coverage, then there are two objectives we are keeping in mind. One is we want to protect people from facing financial hardship when they need healthcare services. It means that when people are seeking medical care, and if they have to pay out of pocket for these services, it may cause those people to face financial hardship. So they may fall into poverty and they are not able to cover their other necessities. So they are not able to buy food for their families or to pay for the heating of their apartment. But that's one part, because it's very important also not to forget that for some people, out-of-pocket payments may create financial barrier, so big barrier that they are not able to use needed medical care. And in that case, we don't see it as a financial hardship. We see it resulting in unmet need. So it's people are not even seeking medical care. They are not buying medicines they need. And therefore, we don't see it, we cannot measure it as an out-of-pocket spending, but we can measure that as an unmet need. And then when we are trying to monitor countries' progress towards universal health coverage, then we have to monitor financial hardship and unmet need. And in European region, we have been doing that for many years already. There are reports published. We have numbers about financial protection for more than 30 countries in the region. And those who are more interested can go and dig deeper into these reports. These are very important. They have a lot of technical nuances, but that's not all. They do also include very practical policy recommendations and providing countries guidance. So if countries are committed to move towards universal health coverage, what they can do, and when they are designing their health financing reforms, so how they can design these reforms better. And now maybe couple of slides with some figures. It might be a bit difficult to follow all these small numbers, but in this slide, you can see numbers about financial protection measured as catastrophic health spending incidents for more than 30 countries in our region. Unfortunately, we don't have data yet for Tajikistan, but we are working very hard with country to get these numbers to become available soon. But we do have numbers for Uzbekistan. And what you can see, Uzbekistan is there in upper right side of the graph. And it shows that in Uzbekistan, currently 80%, almost 20% of households face catastrophic health spending when they need medical care. So it's and also what you can see is that overall out-of-pocket spending level of as a share of overall health spending is very high in Uzbekistan. And what if you look left side of the graph, then you see that catastrophic incidence among these countries is much lower. So it's countries are there like it's 2-4% of households facing catastrophic health spending. But in those countries, what is different is that out-of-pocket spending forms smaller share of overall health spending. So if country relies heavily on out-of-pocket spending to finance health care, it's very challenging, or rather to say impossible, to ensure good and strong financial protection for the population. And looking really like it's all countries in European region, like how much of their overall health spending comes from out-of-pocket. We see that on the left side, there are middle-income countries. Tajikistan and Uzbekistan are in the left. And in both countries, more than half of health spending comes from out-of-pocket. So it is very high, which is very clear policy message that when country is planning health financing reform, one of the objectives and one of the very clear objectives is that out-of-pocket spending, reliance of out-of-pocket spending has to be reduced as a result of well-designed health financing reform. But what we also see that just reducing out-of-pocket spending is not enough. So it's very important that we are also reviewing the coverage policy, what country has, and which means how co-payment policy is designed in the country. And then 3 important takeaway messages regarding out-of-pocket spending and then co-payment policy. It's important to accept poor people and then people who are needing more health care from paying co-payments, because we see that these are people who tend to face financial hardship when they need healthcare services. It's very clear and important policy message. Second message is that when we design our benefit package, it's important also to include priority outpatient medicines into the benefit package to cover them for the people. I know that it's something what Uzbekistan now is planning to pilot, and discussions are also ongoing in Tajikistan. And it is important, and it's particularly important because it's outpatient medicines are important part of primary health care. And that's what all countries really willing to do is we want to strengthen primary health care, to give more role to primary health care, because it's the most cost-efficient way of addressing population health needs. Then as part of that, should be also making priority outpatient medicines available for population. And when countries are designing co-payment policies and when introducing co-payments, so it's of course our ideal recommendation would be not to have co-payments at all, but if co-payments are there in place, then low and fixed co-payments are something what are definitely much easier to implement, and then they are more protective in terms of catastrophic health spending compared to, for example, co-payments, which are in a form of percentage co-payments. So it's low and fixed co-payments instead of percentage co-payments. That's the third policy message. When it comes to high out-of-pocket spending, then of course, but we do see there is a very clear relationship that the role of out-of-pocket spending is higher in those countries which spend less from the public budget on health. So the very important way and the way forward to reduce out-of-pocket spending is to increase public spending on health. So and that's really where the discussion starts. Also, how to do that and what is the optimal level for how much countries should spend on health. And one possibility how to kind of think about like what your target is to look how much of the overall government budget is spent on health. This data is from 2019. It's a pre-COVID pandemic data. We know that during COVID pandemic, countries invested more in health. But we also know that we have to work hard to make to sustain this higher spending level. But as a kind of target, we recommend countries that at least 12% of overall public budget should be spent on health. And as you see from the left side of the figure, then in Tajikistan and Uzbekistan, this percentage is lower. It was lower before COVID pandemic. During the pandemic, of course, it increased a bit, but still there is a room to improve, to reach this 12% target. And my final slide is about kind of some key characteristics of a well-designed financing policy, health financing policy. Just as I said, the first and most important message is that health should receive higher priority in government's budget. But it's also important that it's when we discuss how health financing reforms should move forward, countries like Uzbekistan and Tajikistan, where we know that informality is high, unemployment is relatively high. It's very important to make sure that health system revenues build on broad tax base. So it's a broad revenue base. So it's built on general taxes rather than contributions or insurance premiums. And I can share in the chat when I finish also feasibility study, what we did for Uzbekistan before the health financing pilot started, because also country was thinking which way they should go and which revenue sources to use. And it's a very important lesson learned for many low and middle income countries. Third message is that when health financing, health insurance reforms are designed, it's important to make sure that access to health services will not depend on state payment of insurance contributions. It's important to make sure that everyone is covered. So that's also very important. Fourth message is related to co-payment policy. So it's really when co-payments are there in place, then there should be mechanisms to protect poor people, to protect regular users of healthcare services like people with chronic conditions, to make sure that people don't face financial hardship when they use needed healthcare services. And fifth and final message is that when we talk about health services, then we don't forget that health services also include outpatient medicines. When we talk about strengthening primary health care, then primary healthcare benefit package should also include priority outpatient medicines to make sure that patients, people have access to comprehensive primary healthcare service. I will stop here, and then apologies. Unfortunately, I'm not able to stay with you for the full seminar, but I very much wish you very fruitful and good discussions. Thank you. Thank you so much.
Спасибо большое, госпожа.
Thank you very much, Ms. Habich. That was a very interesting report. It was very saturated, and we're very pleased that perhaps we might be able to ask you some questions later. Your slides will also be available online. We are now going to move on to the most interesting part of the webinar, the presentation of countries and our discussions. We have two speakers. We'll take them in alphabetical order, and our first guest is Mr. Dr. Gafur Muhsinzoda, the first Deputy Minister of Health and Social Protection of the population of Tajikistan. Our guest is a doctor of medicine, he's a surgeon, and he speaks Russian, English, and German. He started working in 1984 in medicine. In 1997, he became the head of the Republican Center for Surgery. In 2004, he started working in the Ministry of Health. In recent years, from 2008 to 2018, he was the head of the State Service for the Oversight of Medical Activity and Social Protection. Since 2018, he's been working as the head of the main office of the Service for State Monitoring of Healthcare and Social Protection. And then since 2020, under a presidential decree, he was appointed the first Deputy Minister of Health and Social Protection of Tajikistan, and he's received many state awards. Distinguished Dr. Muhsinzoda, you have about 20 minutes. You have the floor. The organisers will put up the slides, and if you just say when you need us to change the slide. Distinguished Ainur, participants, I am afraid the speaker cannot be heard. The reforms in healthcare that we have implemented in Tajikistan will be introduced, and these will have been one of our priorities. The issue of reforming the healthcare system has been a key, important aspect of the development of healthcare reforms across the country, and that's for up until 2030. I'd like to express my thanks that we are able to speak here today. Along with Uzbekistan, we're very close to them in terms of language, culture, and geography.
То есть карманных расходов, так и в проценте катастрофических расходов, которые...
So I will be speaking about our expenses and patients' expenses in terms of healthcare. The prerequisites for our reforms of healthcare in Tajikistan were that we had unaffected processes for planning and financing and unjust, unequal distribution of state resources. We also had a reduction in the financial protection of the population. Our main aims were to improve the leveraging of resources and ensure reliable and sustainable healthcare financing systems. We wanted to facilitate fairness in distributing financial resources, improve state procurement for healthcare services, and rationalize medical infrastructure on the basis of the principles of economic effectiveness and the interests of the population. We also wanted to improve financial management and increase financial autonomy of state medical services. Moving on to the normative legal basis for our reforms, we had a document which was the result of a very complex period, and this covers all of the aspects of our healthcare reform system. Of course, all of our documents under this are linked. So we had a general document on the concept of the reforms for healthcare, focusing on high-quality healthcare services. We are working to implement other documents too. These focus on the budget and our strategy for financing the system. We constantly revise these. We have various documents up to 2030 focusing on improving our healthcare system and the healthcare system. We are also introducing parallel reforms in financing healthcare to complement our previous documents and strategies. So we are further seeking to reform our healthcare financing by 2030. We are seeking to take actions to implement a new mechanism for financing healthcare, and we have a strategic plan for 2021. This is fully being implemented. We have introduced a new mechanism for financing state healthcare. This was adopted in 2011. We also have a medium-term program, and this is constantly revised, and it's a priority for our sector. We have also a pilot program for procurement and contracting of services through a single payment system. I would like to note that we have implemented per capita financing across our country. That started in 2007. At the time, the expenses that were excluded were only 10 to 15%. In recent years, namely since 2016, this has been extended to all expenses. We are also piloting other projects in 16 regions, namely a performance-based funding system. This covers different levels, and this includes rural areas and rural healthcare centers. In Tajikistan, we are also introducing case-based payment mechanisms in 3 regions of Tajikistan. 31 regions have implemented a program for state guarantees. As I said, this covers 31 regions. We regularly revise this program. We also carry out monitoring and assessment of this program of state guarantees amongst the population. This program of state guarantees particularly benefits the most disadvantaged groups of the population. Our national health accounts are a tool for tracing funding flows for the healthcare system, and this has been introduced since 2009. We have a database that's been functioning since 2000 to 2020 in terms of establishments, healthcare functioning, financing organizations, and funding. We also have a statistics system which allows us to every year provide information to healthcare centers and information for those working there. We also have a statistic form of reporting. This is form number 20 for our healthcare system under the Statistics Agency. And we are working on automatic collection and analysis of data on expenses for healthcare using a standard software-based center. I'd like to say that in one region of Tajikistan, we have a unified register, a single register, so that every citizen that is provided with funding assistance can access services, and this allows us to be more targeted and precise in our work. I'd like to thank all sponsors, our development sponsors, for providing us with financial but also technical assistance, and we are thankful to other countries for sharing experience. I'd also like to note that on the whole, the work we've carried out with our partners and has been very successful, and the expenses that I've mentioned, first and foremost, relate to medical services. The government of Tajikistan seeks to ensure free healthcare, and we have a single database As I said, we are seeking to, in particular, help the most disadvantaged groups of the population. This is around 20% of the population of patients. We are also providing comprehensive outpatient care at all levels of healthcare, and this is a priority for the government. First and foremost, we are trying to spend our resources on human development. Individuals, in particular those under the poverty line, can therefore receive free healthcare. This has particularly been important in the fight against COVID-19. We've been working with authorities and healthcare communities, and therefore we've had a high level of immunization. And this reflects the need for funding. Thank you very much. Thank you very much, Dr. Muhsinzoda. That was a very interesting report. We'll have the opportunity for questions after our next speaker during the Q&A session. So it's a great honor for me to then introduce the next speaker, Mr. Farrukh Sharipov, the Executive Director of the State Health Insurance Fund of the Republic of Uzbekistan. Our guest also started working as a surgeon. He was the head of the Center of Outpatient Surgery, the head of deputy director of different hospitals. He worked in the Tashkent Medical Association and other medical associations. He's taken up very important jobs, such as the head of the Office for Treatment Assistance under the Ministry of Healthcare in 2021. He was appointed The Executive Director of the State Health Insurance Fund of the Republic of Uzbekistan, Mr. Sharipov. You have also around 20 minutes, and the floor is yours. We can put up your presentation. Thank you very much. Good morning, participants. I'm very grateful to organizers of this webinar. It's a great honor for Uzbekistan to participate in this webinar. My presentation on reforms of the healthcare system in Uzbekistan will focus on introducing state health insurance in the Sirdarya region. Next slide, please. In Uzbekistan, we are reforming all areas of healthcare, including in terms of medical care. Here, the government plays a key role, as well as other interested stakeholders. In November 2020, we adopted a decree and another order of the President of Uzbekistan on further reforms of the healthcare system, namely by introducing a new mechanism for medical care. One of our orders refers to measures to introduce a new model for organizing the healthcare system and mechanisms for state health insurance in the Sirdarya Oblast, the region. Since the 1st of July 2021 to December 2022, we've been introducing this in the Sirdarya region. The aim of this order then was to increase the quality, effectiveness and access of healthcare for the population, broadening the scale of primary healthcare, the gradual introduction of a system of medical insurance in this sphere, and creating a modern, tangible environment for medical services and the market for those, and broadening the possibility to receive guaranteed quality medical care for the population. Our aims were to introduce, in practice, effective mechanisms for financing healthcare and new models for providing medical services, introducing a mechanism for payment for medical services through methods of funding aimed at the final result. This includes per capita funding, case-based funding too. We have an integrated information system and resources in providing healthcare within this project. We also provide its ongoing functioning. Next slide, please. The order of the 1st of December 2020 also organized a fund for state medical insurance. The main aims of this were to introduce and manage a system for state medical insurance, ensuring interdepartmental cooperation in implementing one state policy in the sphere, also introducing a system for strategic procurement of medical services in order to ensure that all of the population have quality, necessary medical care in terms of these guaranteed services. The aim was also to organize accumulated, managed, targeted and effective spending from the state budget to finance the guaranteed packet within the pilot project. The fund is the only strategic fund for medical services. It's very important. Next slide, please. What mechanisms for coordination and management do we have then? Well, we established a supervisory board. We have an individual that works for this. We have a working group under the Ministry of Health, and we have many other departments and councils that work in different regions. The executive director of this fund heads the supervisory council. We have 3 working groups then. The working group of the Ministry of Health on issues of introducing a new mechanism for financing healthcare and on strategic procurement. This group includes specialists, those from the Ministry of Finance, Healthcare and Economy. We also work on introducing a new model for providing healthcare. We also have a healthcare information system. Next slide, please. I'll set out the roles and duties of the healthcare system. So we have the Ministry of Healthcare. They make policies, they set out strategies and priorities for healthcare. They deal with the budget, they provide guarantees in healthcare, and they provide targeted programs. The insurance fund then is the state insurer. They accumulate resources, they procure services, they provide guarantees and monitoring of expenses and quality, and of course they provide the reimbursement of expenses. Then we have citizens. They are the insured. They use the healthcare system. This is our roadmap for introducing the health insurance system. Work started in 2018. In 2020, we adopted the order of the government, and now we're in phase 1, which is the pilot in Sidaria. Then we will expand it to 6 other regions. The capital of Tashkent, the Republic of Pakistan, will also be involved. That will be in the following phases. From 2025, this health insurance system will be expanded to the entire country. Before we adopted this decision to create this fund and implement a pilot project, we did a lot of preparatory work with the participation of the country and WHO offices and experts. We carried out economic research on introducing healthcare based on the tax system. When we prepared the project, we looked into medical equipment, the technical potential of the region, the opportunity for specialists' visits, hospitalizations, surgery. We worked on all of this. We looked at clinical work due to the pandemic, of course. We continued our work, and we looked at different groups of patients. And we have a per capita coefficient. When we started this project, in the Sidaria Oblast, around 60% of the population go to specialists without being referred by their doctor. When we introduced this system on referrals, we focused on referrals. We worked with specialists and services. We wanted to ensure that patients could access services free of charge. The situation has really changed over the last few months. Now, a much higher percentage of patients are referred by their doctors. We established that around 40% of hospitalizations were unjustified. So these were patients that could have been dealt with in outpatient services. We wanted to ensure that all doctors worked in line with standards and protocols when it came to diagnosis, and so our indicators have fallen. So we have this scheme, which you can see on the slide, with the relation between family doctors, GPs, and screening programs. We've broadened the role of nurses on lots of different aspects: nutrition, rehabilitation, management, child development, giving up smoking, and so on. We've also broadened the role of healthcare and we focused on teamwork. Then on the other side, this is linked to specialized hospital services. So this is where city hospitals play a big role. Hospitals carry out surgery, but they also now carry out rehabilitation and palliative care. Next slide, please. On this slide, you can see the family doctor team that we have established. We have, this involves a family doctor, a nurse, and these make up a team of doctors. We've created about 4,000 teams in the region in question. This is our new structure of family clinics. So we have doctors' offices and preclinical offices where nurses and doctors work. They carry out screening, they carry out checks, and then we also have a psychologist office and other offices which carry out other roles.
By the Ministry of Healthcare of Uzbekistan, we've established a package of guaranteed medical services. We've decided that within the frames of medical guarantees, every citizen has the right to receive quality healthcare regardless of which category he or she belongs to. This is all completely free of charge for all the population of this area. 10 different tests are foreseen by the outpatient clinics in a different regional hospital. This number goes up to 16 various free of charge tests. It also includes palliative care and rehabilitation. They are also completely free of charge, guaranteed by the government. What is also really important, the primary healthcare includes inpatient care in the central regional hospitals. All of the family outpatient clinics receive patients. Family doctors is the first stop for every patient. These are family doctors or general practitioners. Outpatient clinics are, their burden is slowly diminished. For example, when it comes to nurses, nurses visit patients very often. This is in order to avoid burden at the clinic, to decrease infectious diseases. We also have an individual surveillance plan. It's a protocol that includes various types of risks. We've improved the consultation, the primary consultations with the with the patients. This decreases the burden of the general practitioners. We've also set up a medical cluster. We've united 6 different establishments into one chain. It's a medical cluster. The emergency healthcare service and the planned healthcare service will be working as one. We are also planning to establish a medical institutions and enlarge it and include various medical establishments in order to increase the capacity of this medical cluster. What exactly will it give us? It gives us new management techniques. It increases the efficiency and efficacy of the management. It also helps us to avoid duplication of our service, to decrease expenditure. We also have a reimbursement project, and here it includes some priority directions, for example, some cardiovascular diseases, second type diabetes, some chronic lung diseases, and all the patients that are listed that are listed in this list. As a matter of fact, the patient gets his medications completely free of charge. The drugstore then sends the bill to the fund, and fund pays the drugstore. What are the expected results? By 2025, we are expecting to increase the transparency and the volume of free of charge medical care, to decrease the sector of informality, to satisfy the demand of the populations and increase the healthcare as well as the life expectancy. When it comes to medical suppliers, we are expecting to increase the stability of finances to promote healthy competitiveness for the society and the government. We are planning to reach the universal healthcare coverage, to improve the transparency of the healthcare system in general, and to optimize the expenditure. That's it. Thank you very much. Thank you very much for this wonderful presentation. It was very interesting to hear about your reforms firsthand. Now that we've went through all the presentations, we are ready to start our discussion, question and answers. I would like to mention once again that I will read the questions in the Zoom panel. Those who have questions, you can ask them. It can be done anonymously, or you can introduce yourself. Please also specify to which speaker you are directing your question. If you would like to speak to the microphone, you have to raise your hand. There is a small icon on your board, and you can press it, and then the administrators will unmute you, and you will be able to ask a question. You can also press like for those questions that you found especially useful, questions asked by other participants. We will publish all the question and answers after the webinar, and I would also like to point out for all the panelists and speakers from Tajikistan and Uzbekistan that we could arrange a small research. It's an evaluation, financing of healthcare evaluation, with the support of the organizers, after which we would publish the analytical note. So if you are interested in such a small evaluation, it's not a scientific, really, it's rather short research, evaluation, and if you would like to do that, please let us know. You can contact me personally after the webinar. Let's see if we have some questions. We have two questions. The first question, Oksana Bovskaya, please, for Uzbekistan.
Что вы сделали с ФАПами в Узбекистане? Скажите, что вы сделали с ФАПами в Узбекистане?
Well, could you please point out what you did with the FAP in Uzbekistan? We don't have FAP at the present moment, as you know. As you know, in the rural area, we did have some narrow gynecological and midwifery outpatient clinics. That's exactly what the speaker was talking about. And we did a comparison. And instead of those outpatient gynecological and midwifery clinics, we set up general outpatient clinics. There are also, of course, regional hospitals and central hospitals. So basically, today we have two stops care medical establishments, and the situation is a bit different right now. We have family doctors, and we also have rural outpatient clinics where some more narrow specialists are permanently present. Of course, there are also some geographically remote areas, and for those people it's very difficult to get some medical care. And we've established outpatient medical clinics there as well. And we provided all the necessary equipment as well, including the sewage for those clinics, clean water, in order to provide for an adequate healthcare to those people who live in remote areas. Thank you very much. One more question. When it comes to financing of outpatient clinics and hospitals in Tajikistan, it's for the who does the financing? Is it the Ministry of Finances or the Ministry of Healthcare? Who pays the maintenance? Who pays for the maintenance of those clinics? Thank you very much for the question. We have two types of financing. It's a Republican budget, of course, and local financing, which goes through local governments, government authorities, who pay for the maintenance of clinics. Back in 2000, the government took this decision on decentralizing of the medical industry.
Поэтому в настоящее время Министерство здравоохранения имеет в своем распоряжении.
At the present moment, the Ministry of Healthcare enjoys the money from the Republican budget. And when it comes to local establishments, they are financed by the local authorities. Another interesting question, if you would allow, when it comes to those gynecological and midwifery establishments, it's a very interesting question, because right now we have transformed them into so-called medical houses, and these are the inseparable part of all the rural medical establishments. there are over 1,700 such medical houses in the country. So using this network of medical houses, we are improving the access to preventive care services and the access to healthcare in general, especially in remote areas. So thanks to this program, the government took an unprecedented responsibility to provide these medical houses with staff, with medical staff. And this is a really unprecedented initiative. We do not have the deficit of staff anymore. And of course, we're also striving for the quality of the health in general, of the healthcare staff. Thank you. Thank you very much. One more question to you. It's yes, I can hear you. Please go on. Second question to you as well. Are you planning to consolidate the healthcare budget on the regional level or on the national level? You were talking about the local financing. Are you planning to consolidate the budget on the regional or national level? Thank you.
Это был вопрос для Гафура Мухсинзода.
I do apologize. Unfortunately, we did not hear the question. Are you considering to consolidate? No, still no sound. Now we can hear you. Are you considering the consolidation of the healthcare budget to the regional or national level? You were talking about the local financing. Are you wishing to consolidate this budgeting and financing on the national or regional level? Unfortunately, I did not hear your question once again. Why don't I write it down to you in the chat? Do you have a chat function? I can send this question to you via chat.
Рассматривается ли вопрос консолидации бюджета здравоохранения на региональном или национальном уровне?
Мы сейчас этот вопрос рассматриваем.
Yes, this question is under discussion. We are planning to introduce a social healthcare scheme. In one of our regions, right now it hasn't been approved yet by the government. But yes, we are planning to introduce the system of governmental purchases, and we're planning to fix it on the governmental and national level. Right now, this work is still underway. It hasn't been approved yet, but it is underway. Thank you very much. Can you hear me now? Can everybody hear me, actually?
Вы слышите меня? Тут есть еще один вопрос. Звука нету. Сейчас.
Если вы ближе к микрофону, мы слышим вас, Айнура.
Так, сейчас вот, а если вот так вот?
Can you hear me now?
Вот так лучше.
Так, а вот так вот слышно?
Да.
Так лучше, да?
Лучше.
Да. Все тогда. Еще один вопрос для обоих стран.
Айнура, мы вас не слышим.
No, unfortunately, we do not hear you.
Это почему-то мне...
Он почему-то прерывается и снижается.
No, unfortunately, the voice breaks all the time. Let me write to the general chat.
Да, я и в чат напишу, и устно озвучу.
Да, лучше написать на чат. Мы видим.
Yes, I think chat is a better choice for this.
Видите в чате, да?
Can you see this question in the chat?
Да, это очень правильный вопрос. Один из рисков, который у нас есть, это вопрос о самозанятости населения.
Of course, when it comes to self-employment of the population, this is a very, very relevant question.
Через патентирование поставщиков частных услуг в государственном секторе, в государственном и частном секторе, то есть это частный сектор касается. И она более-менее налажена, но все-таки она требует улучшения.
And this system requires improvement. Therefore, we had a question to Uzbekistan. How are they accumulating finances for this, for social guarantees?
Но, наверное, они еще не зарегистрированы, потому что налоговое бремя на них применяется. Как у них этот вопрос решать?
How are they dealing with self-employed people? We know that Sirdarinskaya Oblast is one of the poor regions in Uzbekistan. Thank you very much for your question. When we've started this pilot in Sirdarya area, it was in the second part of 2021. The budget was already approved. Therefore, the consolidation wasn't done in 2021, but all of the healthcare budget of the Sirdarya area was forwarded to the fund of the medical insurance. And we executed the payments through the fund. 90% of it is a global budget. However, from 2022, for Sirdarya area budget is over 500 billion. The budget was approved with the local authorities. We have a central accountant services for all the medical establishments and hospitals in the area, and we will be using the accumulated funds. We have an order from the President of the Republic, and starting from 2023, when the budget is approved, this will be considered, and all the money will be sent to the fund of the medical insurance. Thank you very much. Can you hear me? Thank you. Dear panelists, can you hear me? Yes, we hear you, but your voice breaks all the time. We have another question for Tajikistan. Do you have private medical schemes, for example, outsourcing of the GPs to a private provider in the entire area? Yes, it's widely discussed. Right now, the law hasn't been enforced yet, not even as a pilot stage, but since we have an accreditation body, we would like to first accredit all the structures to make sure that they are effective enough and to make sure that they can satisfy all the demands that we will present to them as a providers. And after that, we can consider the private provider. Right now, the only provider is the government. However, in Skitameni region, we do already have such an initiative. We have a unified register, and once all the citizens have been registered there, we are planning to calculate the system and see whether, as a matter of fact, it makes sense to deepen such relationship further. Of course, this research, by the way, talking about your question now, this research that you've mentioned, this evaluation is very interesting for us. We're definitely up for it. And it would be a great pleasure for us to work together with you on such a research. Thank you very much. I hope you can hear me now. Does anybody have more questions? Let's see, we have another question here.
Так, по частной медицине вы ответили. Вопрос по самозанятым ранее задала я. Вам слышно, да, меня?
Can you hear me now? Yes, we were talking about self-employed a few minutes ago. I work in the Ministry of Healthcare in Kazakhstan, and we did have a problem with self-employed because a very large amount, almost a quarter of the population, were self-employed without official salary, and at the same time they're not unemployed. During 5 years we were trying to come to some kind of initiative. So the person whose income is non-official, for example, he's a taxi driver or he's a farmer, and he does not have an official salary that would be shown in our tax system. So he pays a unified amount, which goes directly into social care, medical care, pension fund. So it goes into four different bodies. Thank you very much. Of course, the informal economy sector is always a very highly topical question for any developing country. The work is underway. Even the example that you had just given, it would be extremely difficult for us because in absolute numbers, really, these amounts are very, very small. They are just microscopic, if you wish. Uzbekistan, when it comes to self-employed, in our area, in Sirdarya area, mechanisms of governmental medical care what I'm trying to say is that all the citizens have the right to receive free of charge medical care. All the population of Sirdarya area. Wonderful. So basically all the population is included, regardless of their category. That's wonderful. Thank you very much for your feedback. President of Kazakhstan was forced to replace 2 ministers of labor because our reform of the Ministry of Healthcare was delayed all the time because of our issues on the level of Ministry of Labor. So the government introduced this small amount. It's around $5 per month. Every self-employed has to pay this amount through terminals that are available in any village, in any medical establishment. So basically, he just pays to this terminal. It looks like an ATM machine. He pays these equivalent of $5. And he is covered. He's covered for pension. He's covered for social insurance. He's covered for medical insurance. It's a very, very small amount in order not to scare the people away. But at least this amount, even though extremely small indeed, but it is official, and the person is covered from the moment he starts executing these payments. Another question.
наших организаторов поднял руку, хочет лично задать вопрос.
One of our organizers would like to ask a question in person. Thank you very much. We have very little time left. Well, first of all, let me thank all the speakers for their wonderful presentations. I have a general questions. Both countries have similar problems, share similar barriers in order to reach the universal healthcare. The out-of-pocket payments over 50%, very low. In governmental investments into the healthcare, lower than 12%. Very briefly, I would like to understand how these countries are planning to improve the situation during their healthcare reforms. Thank you very much. This is our focus right now in the ministry, at the level of the Ministry of Healthcare and Ministry of Finances. I'm talking about the out-of-pocket payments. So, after the introduction of these strategic reforms in our healthcare, and as a result of all the reforms that are taking place in the Ministry of Labor and Employment, we are hoping to satisfy the demands of the poorest in our country. Of course, we need to undertake a separate research. All the previous data are completely outdated. So it is important to undertake a new research, a new evaluation. We also have the lowest threshold. It's a system of co-payment. So instead of talking of out-of-pocket payment only, we are planning to introduce co-payments in order to reduce the burden of people when it comes to receiving healthcare. And I believe this could also bring about some order in the informal sector, which is very difficult to manage. When it comes to out-of-pocket payments, mostly we're talking about buying medicine, really. These are mostly for outpatient patients.
Thank you, Dr. Farooq. Briefly, first, we allocate more and more funds for the healthcare. I mean, budget funds, about 14% at present. Second, pilot project in Syrdarya, it's social and medical insurance, where people don't deduct from their salaries. It's just the government package. And yet another government decree was published about high technology medical assistance with respect to the vulnerable people in our society, and funds were allocated from the budget. Contracts were signed with all the medical institutions in Tashkent and with the branch offices elsewhere in the country, where high technology medical assistance will be given, will be provided to the vulnerable people, vulnerable groups of citizens, and it will be free of charge. Well, transplantation of vital organs, everything will be free of charge, irrespective of the price, $5,000, $10,000, etc. So it will be done at the expense and with the help of the government budget. Thank you very much indeed. Your answers and your presentation today were extremely interesting. That's it for the webinar today. Everything will be published on our web page. So thank you very much to all the participants, and I would like to draw the line under this webinar, and the webinar is closed. Thank you very much and have a very nice day.